Welcome to the next segment of our microlearning program on healthcare quality improvement basics. This program is based on the model for improvement recommended by the Institute for Healthcare Improvement, or IHI. This segment will focus on how to implement the changes you have tested by the PDSA cycle. After using the PDSA cycle for testing and refining the change, and when you have achieved the results you want, the change is ready for implementation. Implementing your change is the next step in this quality improvement process. As part of the ACT stage of the PDSA cycle, when you achieve the results you want on a small scale and choose to adopt the change, your team must next think about ways to expand, spread, and sustain the improvements. This is referred to as implementing the change. Implementing your change means permanently changing the way work is done by incorporating your change into the process. This may affect aspects of the organization that were not heavily engaged in the testing phase and require new teams to form. Just like in the testing phase, you will use the PDSA cycle to plan, monitor, and adapt your implementation process to ensure you get the results you want. Using the PDSA cycle will help you identify the right way to expand your change and spread it across the appropriate areas of your organization. As part of the implementation process, your team should identify methods for ongoing monitoring of performance. Identifying and setting up indicators that can alert you if performance starts to change is an important part of sustaining your improvement. You can use the outcome, process, and balance measures you identified earlier in the process to monitor performance over time. Remember, while answering the third fundamental question earlier in the process, your team generated a list of change ideas that might result in improvement. There still may be changes to test to move you closer to or even exceed your quality improvement aim. Remember, quality improvement is a continuous process that encourages all healthcare team members to ask, how are we doing and can we do better, and to take action to make improvements throughout your organization. You should always be actively engaged in quality improvement. Our next segment will cover how to make sure you consider inclusion and health equity in your quality improvement efforts.